afternoon, everyone. Myself, Dr. Shweta Gupta, working as an associate professor in FH Medical College, Agra. My question is, what are the precautions we have to take to prevent vessels injury during OPO?
Okay, who will give the answer? Okay, you tell me what all things to do. So let's hear from everyone. How do you prevent vascular injuries during anything? That's the question here. And basically, we have got vault arteries, we have got uterine arteries, we've got
Ovarian.
general arteries, ovarian arteries, which are
iliac
iliac.
iliac. Hi, I'm Dr. Suprita from Hyderabad. So, how to prevent injury during vessel injury during OPOS? While we are inserting our probe against the vault, after that we have to check any vessels at the entry point before inserting the needle only. At that, 4 checklists will be 3 to 4 checklists will be there. One is at the entry of the vault, and second is while entering into the ovary, we should go in a horizontal manner. We should not insert the needle in a haphazard manner. I mean, when we are going from the white line, we have to go. We have to take two to three follicles. Again, come to that white line, and again we have to go. Parallel, whichever follicles we are seeing from left side or right side, we have to take that before going from one follicle to another follicle. We have to come back at the white line, so that we can prevent injury of the ovary and stromal blood vessels. One point is vault vessels, second point is ovarian vessels, third point is iliac vessels. I mean, at the level of ovary and iliac bed, I mean ovarian bed, we have to check. We should not go beyond 4 to 5 centimeters, because we can injure any other organs or vessels within beyond the ovary, like iliac vessels, or we can injure bowel or bladder also. So before before entering only, we will put color Doppler so that we can check any vessels are there at that point. And beyond 4 to 5 centimeters, we shouldn't go, so that we cannot injure which is not in our sight.
What precautions we have to take if ovary is not accessible? If it is fixed or it is adherent, then what we will do?
So one question which I want to think, which you said but not in the right perspective, something called a pulsating follicle. I've given you some terms in the morning today. We spoke about the dragging effect, spoke about cappuccino effect, and my terms are there is a whiplash injury to an egg. I say the eggs don't wear a helmet. There's a head injury to an egg. So I have got my own different versions of it. Follicles will look like a blood vessel in one axis. And these follicles are pulsating follicles. Another term I'm launching now is called a pulsating follicle, given in textbook of Gardner also. But they pulsate so softly, you can't see their pulsations. And as such, you're in a hurry and you're spanning everywhere, you may miss a pulsating follicle. So as you cross 3 to 4 follicles, or wherever you are, always look at the ovarian cortex. Ovarian cortex you can't see, but when it comes in contact with the bowel or uterine wall, it will be a white line. White line is your Lakshman Rekha. Never cross the white line. The moment you cross white line, you are going beyond the ovary, and beyond the ovary can be anything. When you're doing the pickup, you may find a follicle which is just adjoining the ovary, and you feel it's a follicle only. It's a follicle only. See, first of all, you don't have very high advanced machines in the OT also. We are using a basic machine for OPU. And neither your people are so well trained that they can go and look at the contrast, color, imaging, focus, depth, zoom. They are not so intelligent also. So, but one thing is for sure. Whenever in doubt, just put a color. The moment you are going near the white line, just put the button called C. See, those people, you say, give me more focus or give me more depth. Suppose you're looking at a follicle which is not looking a healthy follicle, looking like a vessel. So I will tell my assistant, give me more depth or zoom this area. उसे क्या पता क्या zoom करेगा क्या depth आपको पता है? In case I ask you, can you do it on your machines? In darkness, half the people I can say you cannot do. where to make the window and zoom that area. But for a blind man, pressing button C will give you color box. Simple. And you only want to see the color. Okay. So liberally use color. And in case you just near the white line and you see any box being present, put the box there. Any color, then you can leave that follicle. Number one. Number two, in case you inadvertently go inside a follicle. Worst come worst, this can also happen. One puncture won't cause any problem. Many people say, same side, press with the probe, keep it there. Yes, you can do it, but I don't know how effective, because we are on a 2D scan where that vessel is bleeding or spurting, we never know. Bowel is all around that spurter, we can't make it out. But you can pack the vagina tightly, put the probe on that side and press it hard. That's all you can do. But I can assure you that one odd puncture here and there won't cause any problem until you go to the wrong pulsating follicle or the vessel. Then keep doing multiple punctures. Coming to a follicle lying across the uterus, meaning that follicle is adherent and it is lying on the just behind the uterus, then what do? I say leave it. Because until you have full maturity, full surety that you can go through the uterine wall, that the time you put on the color flow on, look at an ascending, you look at the uterine arteries, and then you circumvent them. But there you'll find a uterine artery, you'll find a ureter, you'll find parametrium. You don't know if you may make a mistake. So never go through a cervix or a uterus. Now many people say, why not? So my question is, how many follicles can you access in case you go through the uterine wall? Just want to ask you. कितने फॉलिकल ले लेगी तुम?
Maximum 2 or 3.
दो भी नहीं ले पाएगी, दो भी तीन भी ले पाएगी बेटा, जब दो फॉलिकल एक ही लाइन में आ रहे हैं तो. But normally you can take only one follicle, because then you cannot move it, no. So for one follicle, why do you want to take so much of risk? I'm not saying that you become a weak-hearted surgeon, but become an intelligent and sharp surgeon. Don't give them a complication for one egg. Yes, you can do when you are in a tertiary hospital, you've got 2 or 3 friends with you, all are good people. They say, okay, करेंगे ना, करते. कुछ होगा तो देखते. Nothing wrong in it. But on your own, in a small units of yours, don't try to chase every egg through parametrium or a cervical wall or uterine wall. Leaving a follicle is a better answer at that point of time. If you do it, there's a chance of injury. Inform the patient's husband that time, and you can definitely do it. But as a routine, avoid going through uterus and the cervical architecture, and avoid going through